Hi, I'm Dr. David Matson. I'm the program director for the anesthesiology residency for Tower Health, and I'm the chairman of the Department of Anesthesiology for Reading Hospital and Tower Health Medical Group. The program is a 4-year categorical ACGME approved program, which means we start at the PGY1 level and will help our trainees to evolve over the course of their 4-year training program. The first year is a clinical base year, much like many transitional years, where our learners will rotate through various services that interact with our profession and will learn from those perspectives. So they'll spend months in general surgery, internal medicine, pediatrics, OBGYN, emergency medicine, critical care, neurocritical care, transfusion medicine, pulmonary medicine, pain medicine, and a month in anesthesiology in an effort to kind of get a rounded overall viewpoint of how an anesthesiologist functions in the context of a larger health system. Our residents will be clinically oriented, well-trained clinician leaders. Our program is designed to help our learners to become exceptional physicians who will add value for their organizations, who will be able to provide exceptional care for patients, and who will be able to lead departments in a rapidly evolving healthcare environment. Our clinical faculty are at the top of their game. They're people who are exceptional in pain medicine, cardiac anesthesia, neuroanesthesia, obstetrical anesthesia, critical care. So they will be learning from people who are clinically oriented experts and learning best practices. It's critical that our residents learn in an environment that covers the full scope of practice. We are a 720-bed level 1 acute care hospital. Our learners will have experiences that will be state-of-the-art, that will be technologically advanced, and yet at the same time feel as though they are working with their neighbors and their friends in an environment that's extremely receptive, warm, and engaging. We know that having you happy in your personal life makes you a better physician, makes you a better caregiver. And so we fully recognize that, not just for our residents, but for all of our staff. So we work in an environment that is a team model. Over the course of the day, our residents will learn in environments that will span the scope from general surgery to obstetrical surgery, gynecologic surgery, ENT, urology, plastic surgery, neurosurgery, cardiothoracic surgery, the broad scope of care that's provided. Our residents will participate in kidney and liver transplants on a fairly regular basis with experts who are at the top of their game. Anesthesia is an early morning sport. So we get up early. We typically hit the ground running at about 6 o'clock in the morning and set up the clinical sites. By about 6:45 or 7 o'clock, we're seeing patients. And typically, our operating rooms begin between 7 and 8 o'clock in the morning. We run 24 operating rooms, multiple procedural areas, electrophysiology labs, obstetrical floors, and have multiple off-site surgical center arrangements. We take care of about 35 clinical sites per day, so it's a busy place. You will benefit in our program by experiencing by Reading Hospital, St. Christopher's Hospital for Children, and then from the experience of being a part of a large collaborative health center where we will frequently receive referrals from those other hospitals. Reading Hospital 4 years ago developed the HealthPlex. HealthPlex is a $400 million tower that was developed in a very patient-facing way in order to provide optimal procedural care for surgical and procedural patients. It was developed in a manner that was extremely thoughtful and forward-focused. We have 24 state-of-the-art operating rooms, 6 of which are hybrid operating rooms. Throughout the day, you see natural light in a way that I didn't experience in other facilities. This is a great place in terms of making sure that you stay connected to what's going on in the world around you. I believe that education should be a daily routine. And so every day, our learners will be engaged in some academic endeavors. Mondays in particular, we have quality and professionalism meeting, which means we will meet with the call team that existed over the weekend and we'll go over what happened in order to look and see where there might be opportunities for improvement, but also to allow our learners to learn and grow from the experiences of the other residents and the attendings. First priority always has to be patient safety. So our learners need to participate in clinical care in a graduated manner, meaning when you begin in our program, you will be fairly closely supervised. We want to make sure that you learn in an appropriate environment. Once you have been determined that you've built that foundation, then we begin to kind of pull back just a touch. So we begin close indirect supervision or 1-to-2 supervision, allowing you to grow and evolve from more simple clinical procedures into more advanced and complex procedures based on your comfort, based on our evaluations, based on our assessment of your growth. Residents grow at different speeds, and that's okay. It just means that we need to continually reassess where we are so that we can allow you to grow and evolve such that by the time you leave our program, you will have the clinical skills, the judgment, and the technical skills to be a wonderful provider.